Turning 65? Don't miss this deadline. Turning 65 does not automatically mean you should start Social Security, and stopping work does not automatically enroll you in Medicare. Those are two different decisions. One wrong assumption about Medicare Part B can leave you without doctor coverage, delay your enrollment, or add a penalty to your premium for years. In this video, I will show you exactly what to do through 3 realistic situations. Someone who is retired and has COBRA, someone who is still working, and someone covered through a working spouse. By the end, you will know when to enroll, when you may be able to delay Part B, which forms you may need, and how to avoid a dangerous gap in health insurance. Linda, doesn't everyone automatically receive Medicare when they turn 65? No, that is one of the biggest Medicare misunderstandings. Many people who are already receiving Social Security retirement benefits before age 65 are automatically enrolled in Medicare Part A and Part B. They should receive a Medicare card before their coverage starts. But if you are not receiving Social Security yet, Medicare enrollment is generally not automatic. You normally need to apply. That means you can enroll in Medicare at 65 without applying for Social Security retirement benefits. Remember this sentence: Medicare eligibility begins around age 65. Social Security retirement timing is a separate decision. For many people turning 65 today, full retirement age for Social Security is 67. Starting Medicare does not force you to start Social Security at the same time. Check your mail, your Social Security account, and your Medicare status several months before your birthday. Do not assume a Medicare card will simply appear. When should someone start the Medicare application? Your first Medicare enrollment window is called the Initial Enrollment Period, or IEP. It lasts 7 months, 3 months before your birthday month, and 3 months after your birthday month. Let's use a clear example. Maria turns 65 on October 18, 2026. Her initial enrollment period begins July 1st, 2026, and ends January 31st, 2027. If Maria enrolls during July, August, or September, her Part B coverage can begin October 1st. But if she waits until October, her coverage generally begins November 1st. If she waits until November, it generally begins December 1st. That is how a person can turn 65 and still create a gap in doctor coverage. Coverage begins on the first day of a month. It does not begin on the exact day of your birthday. Use Medicare's official enrollment date tool or confirm your exact dates with Social Security. People hear Part A, B, C, and D. What do they actually need? Let's make this simple. Part A is hospital insurance. It helps cover inpatient hospital care, skilled nursing, hospice, and some home health services. Most people receive Part A without a premium because they paid Medicare taxes while working. Part B is medical insurance. It helps cover doctors, outpatient services, and medical equipment. Part B is not free. In 2026, the standard Part B premium is $202.90 per month. The annual Part B deductible is $283. After the deductible, a person with original Medicare generally pays 20% of the Medicare-approved amount for many Part B services. You pay the Part B premium even during months when you do not use a Part B service. Part C is Medicare Advantage, a private plan alternative. Part D is prescription drug coverage. Even when you take no prescriptions, going 63 days or longer without Part D can lead to a late enrollment penalty. Medigap is different. It helps with original Medicare costs. Maria stopped working on March 31st, 2026. She turns 65 in October. Her former employer allows her to keep COBRA through December. Maria thinks, My COBRA lasts until December, so I will wait until December to apply for Medicare. That could be a serious mistake. COBRA is not health coverage based on current employment. It does not extend the Medicare Part B special enrollment period. If Medicare should have been the primary payer and she did not enroll, the COBRA plan may pay less or refuse costs. Before turning 65, ask your plan, will this plan remain primary? Get it in writing. Now consider James. James turns 65 in October, but he plans to continue working. He has coverage through the company's active employee group health plan. Because the employer has 20 or more employees, the employer plan generally pays first and Medicare pays second. James may be able to delay Part B without a penalty while he remains covered, but he should not make that decision based only on advice from the break room. James should ask his benefits administrator, is this current employment? How many employees are counted? Who pays first? And is the drug coverage creditable? If an employer has fewer than 20 employees, Medicare generally pays first. In that situation, the employer plan may pay as if the person already has Medicare. Do not simply ask, can I keep my insurance? Ask, who pays first after I turn 65? That is the question that protects you. What if James contributes to a health savings account? This needs special attention. Once you are enrolled in any part of Medicare, you generally cannot continue making tax-deductible HSA contributions. The problem is that Part A can sometimes be retroactive for 6 months. That retroactive coverage can turn recent HSA contributions into excess contributions. SSA advises people to stop contributing to the HSA at least 6 months before applying for Medicare. You can still spend what's already in there. Susan is not working, but her husband is still actively employed. She is covered under his employer group health plan. Coverage based on a spouse's current employment may also allow Susan to delay Part B. The important word is current. When her husband stops working, Susan may receive an 8-month special enrollment period to enroll in Part B. But the 8-month window is not a recommendation to remain uninsured. Apply before the employer coverage ends whenever possible. Start the process about a month before the current coverage ends to reduce the risk of a gap. What forms does someone use after delaying Part B? If you already have Part A and are using the employer coverage SEP to add Part B, 2 forms are involved. CMS-40B is the application. In the remarks section, clearly state, I want Part B coverage to begin, followed by the month and year. CMS-L564 is the request for employment information. It is used to show you had group health coverage based on current employment. The employer normally completes the information section. Keep trackable copies of every page you submit. If the employer refuses to complete the form, do not give up. SSA permits alternative evidence like pay stubs, W-2s, or insurance cards showing effective dates. Complete the employer section as well as you can and submit following SSA's instructions. If you miss your windows, you may have to use the general enrollment period from January to March. You may also face a Part B late enrollment penalty of 10% for each full 12-month period you delayed. This usually lasts as long as you have Part B. Once someone has Parts A and B, how should they choose the rest of their coverage? Path 1 is Original Medicare. You may add a separate Part D plan and a Medigap policy. Your federal Medigap open enrollment period lasts 6 months from when you are 65 and enrolled in Part B. This is your best chance to buy any policy regardless of health. Path 2 is Medicare Advantage. You receive services through a private plan. Do not choose a plan only because of a $0 premium. Check your doctor network, hospital list, prescriptions, and annual out-of-pocket limits. Use SHIP for free counseling. Some people pay higher premiums because of income. This is IRMAA. If your income dropped because of a life-changing event, like retirement, you can ask Social Security to reconsider using Form SSA 44. Do not ignore the IRMAA notice. If you have limited income, you may qualify for a Medicare Savings Program or extra help with prescription costs. Apply even when you believe your income may be slightly too high. Medicare and Medicaid are different, but you may qualify for both. Before your 65th birthday, answer these questions. Is enrollment automatic? When is my IEP? Is my insurance based on current employment? Does the employer have at least 20 employees? Am I contributing to an HSA? What month must Part B begin? Will I choose Original Medicare or Advantage? And could I qualify for IRMAA reduction or extra help? Do not wait. This is Linda's Social Security Guide. Subscribe for clear, practical help. Subscribe for clear, practical help with Social Security, SSI, SSDI, Medicare, and retirement without the confusing language.